but other stakeholders may not realize is that rare diseases are very expensive, and that includes undiagnosed and untreated rare diseases. So, a few of the cost categories that I've and other people that we've engaged in conversation about this topic have identified is the diagnostic journey, the expenses incurred by visiting specialist after specialist, labs after labs, the inpatient and outpatient costs involved with uncontrolled disease progression, the cost of palliative care, the lost economic productivity of patients and caregivers when one or more person is actually taken out of the workforce in order to manage a very serious rare disease, and other private and social costs that often go unrecognized. So why would it benefit us as a community to potentially start to quantify exactly how expensive undiagnosed and untreated rare diseases are? The biggest and most compelling reason is that the solutions that we all need as communities to move forward, we know are expensive. So biomedical research and incentives for more rare disease treatments are generally big ticket items, and they result in sticker shock often when we're engaging with lawmakers and public health officials. So I think the rare disease community as a whole is really expert at this point in terms of making the humanitarian case for rare disease research and therapeutic development, but we know that that's not a silver bullet for making change, and we know that's not a silver bullet for winning the allies that we need for the solutions we need. So what we're proposing and what we've identified as a potential solution and value add is quantifying the costs of untreated and undiagnosed rare disease. By quantifying the cost of the status quo, by quantifying the cost of inaction, we can potentially recruit more allies that are interested in the economic case for treating and managing rare diseases. So this idea is not new, and it's been utilized by advocates for a long time. On the screen right now is Mary Lasker, who's also known as the godmother of cancer research, and she phrased this entire sort of approach much more succinctly when she said, if you think research is expensive, try disease. So the Community Congress first began serious discussion of this idea back in July 2018 when there was a survey distributed to the Public Policy Working Group, which found that 90% of the Public Policy Working Group supported an idea of a burden study. A subsequent study confirmed that there was not only general interest, but deep interest in terms of moving this forward as an independent priority, and consensus was confirmed at a follow-up meeting. And today, there's been some really exciting progress made on that front, thanks largely to the great staff here at the Every Life Foundation. So the first update has to do with a private study that the Every Life Foundation is funding that is due to be complete in 2019 that will look at this question. The group that they have chosen to partner with and contract with is the Lewin Group, which has previous experience doing this kind of study to great effect. So on the right, you can see here an example of one of the Lewin Group's clients for a similar project, the Alzheimer's Association, which has actually developed several successful campaigns following their work with the Lewin Group that demonstrate how expensive Alzheimer's is for, in particular, public payers, which has galvanized the government to provide additional research funding support to address an impending public health crisis. So there's some information on the slide here about specifically what the Lewin Group will be looking at in terms of the specific rare diseases that they'll be examining. Unfortunately, not all rare diseases can obviously be looked at, not every single one, but they selected what they felt would be a helpful and representative first start. And what you can do right now is, when I was listing some of those costs related to rare disease, there was non-medical expenses, indirect expenses. I know that in our community, the fibrous dysplasia McCune-Albright syndrome community, two of the biggest indirect expenses, non-medical expenses, would definitely be the loss of economic productivity, and that's not only for the patients but also for family, as well as the inpatient costs, because there's a lot of surgical palliative care that doesn't actually stop the progression of the disease, but is extremely expensive. Chronic series of surgeries is not uncommon in our community. But we don't, the Every Life Foundation and the Lewin Group need to hear from your communities about what are the costs that are really hitting your families and that, are really prevalent in your community. I remember at the recent Rare Disease Week event, making contact with a few families and realizing that there was a common theme of a lot of people moving, right? And that's something that I've seen in our community as well, people realizing, we can't live in the home that we have anymore, not with this disease. And some of these non-obvious costs, by bringing to light what you're hearing in your community, you can help the Lewin Group make sure that they don't miss major cost categories. The other really exciting development that's come out of the Community Congress's support for this initiative is the idea to pursue a NASEM study, so also known as the academies. So, the government, while they will, I think while we know that lawmakers are going to appreciate the data that we provide out of the private study, by having also a more comprehensive publicly funded study, we're also going to underline the credibility of our argument. So the idea for moving forward here is to pursue a $1.5 million appropriation for a NASEM study. This would be a longer-term study. We wouldn't have the data nearly as quickly, but it would be important in the long term for being able to make the different public health arguments that we think need to be made. So I won't speak too much to the timeline other than to group out that things are going to be moving very quickly. So the appropriations process, which started off a little late this year because of the government shutdown, they still want to end it on time. So we expect things to move very quickly. So right now what you can do is to spread the word with your policymakers and your community about this burden study. You can tell your story and explain how you believe that rare disease costs are unappreciated in undiagnosed and untreated rare diseases. And ultimately submit requests to members of Congress. In particular, if there is a group that is disproportionately important here, it would be the Labor HHS Subcommittee of the Appropriations Committee on both sides. Soon there will be a Dear Colleagues letter led by the Rare Disease Caucus, and that will be circulated, which means that all of your representatives, regardless if they're on the subcommittee of relevance, are going to be able to express their support by signing on to a letter in support of this study. Additionally, there will be a stakeholder letter. So patient associations like the Fibrocystic Foundation and many of the groups on the call are going to be able to sign on and express their support for a study like this one. All of these action steps, both on the NASEM and on the Lewin Group side, are being stewarded by the staff here at the Every Life Foundation. So if you have any questions about this initiative or how to get involved, you can send those to the fantastic folks here on this team.
Just a question, is it fair to ask them or not?
If we could hold questions till the end, that would be.
Thanks, Shannon.
No problem. Thank you, Deanna. So next we'll have Steve Silvestri from the Every Life Foundation give you more information on the President's budget and its effects on rare disease community.
Thank you, Shannon. So I have right here a link to the White House's budget page. This is all publicly accessible information, so I'm going to give a brief overview of some of the top-line funding at some important health agencies. They do really drill down to the actual program level and get into the millions and hundreds of thousands of dollars figures, so this is all available if you want to go look up specific programs that your community is involved in, and it's at that link right below there at the White House's website. So I just want to remind everyone at the start of this that, the President proposes a budget, but it is Congress that actually writes the appropriations bills that get signed into law. So we saw 2 years ago in President Trump's first budget proposal a very significant cut of billions of dollars to the National Institutes of Health. And I know that worried a lot of people, but the appropriations committees ended up actually increasing the National Institute of Health's funding for that year by billions of dollars. So while this recommendation is something that Congress pays attention to, it's not time to get alarmed if programs that are important to you are cut or eliminated in the president's budget. There's still a long process and plenty of opportunity for you to engage with Congress to make sure that the bills they write actually fund those programs. First is the National Institutes of Health. A lot of you know how important the biomedical research supported by this funding is, both here at their Bethesda facility and also for extramural research throughout the country at universities and other labs that support a lot of very basic biomedical research. The president's budget does propose a significant reduction of $4.6 billion from the current level of $3.8 billion. So that's an opportunity. If NIH funding is important for you to engage with Congress and let them know how important NIH funding is to you. We saw this, in the last couple of years, that the Senate and House committees on the appropriation side, as well as the full, caucuses on each of those chambers, were really supportive of increasing NIH funding, and they were able to increase it despite proposed cuts from the administration. Next is the Food and Drug Administration. Often overlooked, this is a very important agency for the rare disease community. If they're funded adequately, they have the staff and resources available to move treatments and cures through the approval pipeline more quickly, more efficiently. They have the opportunity to actually look at new ideas, novel innovation, and when they're not adequately funded, they don't have the time or bandwidth to be able to do that. So funding the FDA is very important. And the president's budget does propose an increase of $362 million in the discretionary funding for the FDA. So we're actually pretty happy with the proposal from the president on FDA funding, and we'll be sharing our support with Congress for this increase. It's also important to note that when it comes to FDA, a lot of their funding comes from user fees from pharmaceutical companies and the tobacco industry. So the actual full budget of FDA in the president's budget is $6.1 billion, but half of that comes from those user fees, which are negotiated separately from the budget and appropriations process. And that $3 billion roughly mark is what the Appropriations Committee in Congress actually give in what's called discretionary budget authority to the FDA. And last, I want to touch on the Health Resources and Services Administration. This is a very important program for those of you interested in newborn screening. It funds the bulk of the newborn screening programs that support what the states are doing. Often when states do not want to add conditions to what they screen for, or do not want to align with the federal recommended screening panel, funding and a lack thereof is their number one excuse for not being able to do so. So having increases to these programs on the funding side will allow them to screen for more conditions, which benefits the whole community. On an aside, we're hoping to have the reauthorization of the Newborn Screening Saves Lives Act introduced in the next couple of weeks, and the funding levels in that bill are going to be significant increases from what there has been in the past. But those funding levels, even if the bill is enacted, are just a precursor to what actually happens during the appropriations process. To get the funding to the states, it needs to be matched by what the Appropriations Committee puts in their bills. So this is an opportunity to really support newborn screening. And the president's budget proposes about $1 billion cut to HRSA from last year's enacted levels. And that's something that if you're very interested in programs with underserved communities, a lot of physician and nurse support programs in underserved communities, and newborn screening programs, it's something that you'll want to pay attention to. And there's also some newborn screening programs within the CDC. One of those in particular are the quality assurance programs at the CDC, and the president's budget proposed unspecified levels of funding reductions to those programs. So that's another opportunity for people to engage, again, if newborn screening is something that's important to your community. And lastly, I just want to note on what you can do next. So Congress writes these bills, but it's really the subcommittees within the Appropriations Committee that are doing the hands-on writing on the line-by-line and program-by-program funding levels. The Labor, Health and Human Services Education Appropriations Subcommittee has jurisdiction over most health funding programs, and the Agriculture Subcommittee has jurisdiction over FDA funding. The Senate and House have committees that essentially mirror each other, so you may want to look on their websites on who the members of these subcommittees are. They might be your representative, your senator, and that creates an easy opportunity for you to reach out to them and let them know what funding is important to you. Also, reach out to your members of Congress, because even if they're not on the committee, they will be engaging with members on the committee on what's important to them. So you want to make sure that, at the very least, your members of the House and Senate know what's important to you on the funding process. And, now that the President's budget has come out about a month late due to the shutdown, the appropriations committees have started the process, which will first be hearings with all of the heads of the departments and agencies to come in and justify their budget proposal, and then they'll begin writing the bills with the ultimate goal of having legislative text by June to bring those bills to the floor. So if you do want to get involved in advocating for specific funding, now is really the time to do it. Pick up the phone today, send the email today, because they are very much in the process right now. And that's all from me.
Great, thank you, Steve. Heather, are you on the line?
Yes, I'm here.
All right, great. So Heather, why don't you go ahead and provide your update on the Lymphedema Treatment Act.
Great. Thank you so much for giving me this opportunity. I'm the founder and executive director of the Lymphedema Advocacy Group. I'm also the child of a 12-year-old boy who was born with primary lymphedema. And primary lymphedema is a rare disease in its own right, but it's also associated with 40 other rare diseases. Some of those patients will also develop lymphedema. So we're off to a great start so far in this Congress. Our Senate bill was reintroduced on February 14th, and we actually have 48 co-sponsors currently. We've gotten 3 more just in the days since I made these slides. On the House side, our bill is going to be reintroduced there next week on Thursday, the 28th, and we are in the process of gathering original co-sponsors for that bill. We're at over 60 right now, so we're excited that that bill is going to get a very strong start as well. And when we get to one of my later slides, I'll show you where on your website you can go to help us gain support for both bills. We are definitely still in the process of gathering originals for the House and, of course, adding to the Senate bill. So there are ways that everybody can help with that by contacting their own members of Congress. If you can go to the next slide, there we go. So this, on the left side of the screen here, the How You Can Help menu is what you will see on the left side of every page of our website. So we always have an email form at the top where you can email your members of Congress, and there is a template letter already provided, so all you have to do is fill in your name and address, but it's great if you personalize the letter as well. And then we also have call pages for each chamber, and there we provide the phone number for your senator or your representative, as well as a call script. And then also on that page, it will tell you if your member of Congress is already a co-sponsor or not. So if they are already supporting the bill, you can still call and say thank you, which is great as well. And that menu will also take you to all of the other ways that you can get involved with supporting the bill. And if you go, and that's my son, by the way, when he was younger. Yeah, and here on the next page, we have our lymphedema lobby days are coming up in early May. They are very similar to the RDLA Hill Day, which I just had the pleasure of attending. We do schedule all the meetings for you, and we put you in groups with other people from your state, so no one has to go to a meeting alone. If you're the only person attending from your state, we do pair you up with another state. So that is coming up, and registration is open at this time. We also have a block of discounted hotel rooms available for a couple of more weeks or until they're sold out. And everyone is welcome at that event, including children. We don't expect that anyone has had prior experience. If you've never done it before, you're still very welcome. And we do training in advance via webinars and materials that we will send you. And we also have a reception the night before where we provide dinner and also do some on-site advocacy training. So it's also a great opportunity just for lymphedema patients and their families to connect with others in the lymphedema community, because often they don't know anyone else who's dealing with this condition. So it's just a great networking opportunity, as well as a time where people can come and help us raise support for the legislation. So that's it for my update. I will stay on in case anyone has questions at the end, but you are always welcome to contact me. That's my email address there at the bottom. And there's a lot more information on our website. If you are not already familiar with this legislation, you can find a lot more information on our website. And just in a nutshell, if you have not heard about the Lymphedema Treatment Act before, it will provide for coverage of the compression treatment supplies that are the single most important component of treatment for this chronic disease. So thanks for the opportunity to give an update and for all the support that RDLA and everyone in the rare disease community has given this bill.
Great, thank you so much, Heather. Is there, by any chance, is Camille on the line? Are you there, Camille? Okay, I don't see her on our list of attendees at the moment. So I will go ahead and skip ahead and provide an update on Rare Disease Legislative Advocates Program. So I want to give a quick update on the Rare Disease Congressional Caucus. As some of you may know, especially if you attended Rare Disease Week on Capitol Hill, that we have two new co-chairs to the caucus. Representative Gus Bilirakis has joined Representative Butterfield on the House side to be a co-chair of the caucus. And most recently, Senator Wicker has joined Senator Klobuchar as the Senate co-chairs of the caucus. So we're very excited to be working with the co-chairs and to continue to help the caucus. Thanks to Rare Disease Week on Capitol Hill, we have so far, it's an ongoing process, but so far we have 12 new members of the caucus. So we're up to 112 members in the House and 17 senators in the Senate. So especially in the Senate, that was a nice jump. So if you haven't reached out to your members who are not already members of the Rare Disease Caucus, you can still do so and ask them to join the caucus, and you can find out whether your representatives and senators are members of the caucus by going to our website, rareadvocates.org/rarecaucus. And I had just mentioned Rare Disease Week on Capitol Hill. It was our biggest Rare Disease Week on Capitol Hill. If you don't know, it was this February, just a few weeks ago, and we had over 800 people in DC participating in at least one event during Rare Disease Week on Capitol Hill. And we had over 425 advocates participating in almost 300 meetings on the Hill in one day. It was a really wonderful day to see all the advocates on the Hill. And so thank you to everyone who attended, who came to DC and attended our events and were on the Hill meeting with your members of Congress. And a special thank you to our volunteers who helped throughout the week. Here's some pictures of just a few of them. It was wonderful to have that support throughout the week. It's a big event, and we really appreciated everyone's efforts to pitch in and help along the way. I will put out a pitch for our next meeting, save the date, April 11th, Thursday at noon Eastern Time, 9 a.m. West Coast time. And as always, if you're working on policy issues and would like to speak on them at an RDLA meeting webinar, please don't hesitate to get into contact with me. Also, if you're interested in particular topics or issues, please feel free to contact me as well, because we would love all of your input on what policy issues you would like to hear more about from us. I'm going to double check to see if Camille has made it on the line yet. Camille, are you there? Okay. So unfortunately, it seems that Camille hasn't made it onto the line yet. I know that we had a few questions. Perhaps, actually, let me go ahead and unmute the line if Camille will then be able to, if she's on. So I'm unmuting the line. So if you're in a busy area, if you can mute your phone, that would be much appreciated.
Hi, Shannon. Hi,
yes,
Shannon.
Camille?
Yeah, sorry, I wasn't able to log in through the WebEx, so I didn't have a pin to allow you to hear me. So my apologies.
That is fine. Go ahead.
Great. So I just wanted to take a moment to let everyone know that the patients and providers for medical nutrition equity, I think most of you should be familiar with the coalition, but at the very least, the effort that we've been undertaking to improve access to medical nutrition. We will be holding a Capitol Hill Lobby Day, May 6th and 7th, and we'd like to invite anyone who is interested to join us in Washington, D.C. For that Lobby Day. We will start with a briefing on May 6th at 3 o'clock, where we will basically go over the purpose of the Lobby Day and what we'll be asking our lawmakers to do, and that is to co-sponsor the Medical Nutrition Equity Act. And then the next day, everyone will head to Capitol Hill for meetings that will have been prearranged for you. Registration is live, and Shannon, I don't know if you had the slides that I sent to you. If not, maybe we can circulate the information around. But you can register online, and you can go to the website nutritionequity.org, and we're asking everyone to register by April 5th. And we'd also encourage you, even if you can't make it or if you're planning to attend, to help spread the word. So we have a page on Facebook that we would like you to like and to share with your friends. And you can just go to Facebook and search Nutrition Equity, and you should find it. We also have a Twitter account now. So we would love for you to follow us and to tweet at us and retweet. And the handle, our Twitter handle is @NutritionEquity. And then lastly, we would really love your stories. And there is a portal on our website, nutritionequity.org, where you can share your story. And these stories will absolutely help us in our advocacy efforts. We're tracking it by state. So if we walk into a congressional district or to a senator from, let's say, Pennsylvania, we can say, we have stories from 30 advocates in your state, let us share them with you, or get on our website and click on Pennsylvania, and you can learn more about how the lack of access and coverage to medical nutrition is affecting people in your state. So there's a lot of ways that you can be involved in the coalition's advocacy efforts. Coming to our Lobby Day, May 6th and 7th, is just one way to do that. And certainly if you have any questions, Shannon can put you in touch with me or my colleague Megan Gordon-Dunn, but there's a lot of information on the website at nutritionequity.org.
Great.
That's all, Shannon.
Yeah. Thank you. Well, thank you everyone for joining us. I appreciate it, and we look forward to joining us again in April. Thank you.